Hello, everyone. Welcome back. We had Denise Conway on last week. And so if you missed part one of our interview series, please go back and watch it. We talked about pros and cons of surgery for prolapse and some other things that you might want to try first instead, or at least look at first instead. So that was our first interview. And this is part two. We are going to really hone in on pelvic pain and tension today, which I know is kind of a pet love of Denise's, and it also is of mine, because we both see so much of this in the women that we work with and connect with. So pelvic pain and tension, what to know and how to help. So Denise, if you want to just kind of take it away, launch in with however you want to start. We could talk about this forever, I'm sure. So
we definitely could. I mean, pain is such a complex subject. Now, and when it comes to pelvic pain, I mean, you've got the three main kind of centers there in the pelvis. You have your urinary function, your sexual function, and your defecation. So everything is very close together, and there's just so many nerves. And because that's the area where we have all our wonderful orgasmic sensations come from there as well. It's when anything goes wrong down there, it can really knock everything out of kilter. And pelvic pain, it's something that I've experienced in my own life, and many of the people that come on the platform or watch my YouTube channel send me messages asking how can I deal with this, what can I do here? And I didn't realize what a massive issue it was. Now, one of the things that I have been doing a lot, I did have overactive bladder following my mesh removal, as well as all the other things, and that was accompanied by pelvic pain and different things. And in my research for overactive bladder and for trying to kind of get a grip on overactive bladder, that's when I started to look at pain science. Now, very often the people that have pelvic pain, so chronic pelvic pain or overactive bladder, they've been to all the specialists and nobody can find anything wrong. It's just that there's extreme pain and it's debilitating. It's difficult to do anything when you have that level of pain going on and in such a sensitive area. So how to get around it, and this is where starting to look into the latest research in pain science. What is very evident is that what you think about your pain has a huge bearing on how that pain feels and how it manifests. Now, that doesn't mean...
One more time. What you think about your pain has a huge bearing on how it manifests.
Yeah. So if you believe that the cause of your pain is something sinister, the pain will be worse than if you believe that it's not. So if you think, let's say you think that your pain is because, God forbid, it's cancer or something, there's something terrible going on down there, that's what's causing my pain, then that's going to have a huge impact on how you feel every day and how you move and how you think. If you think that the pain is because you pulled a muscle and the muscle's going to heal in a couple of weeks, you're less likely to have an extreme reaction. Now, the challenge is that you can't just decide I was thinking it was something sinister, but I'm just going to change my mind now and think that it's not. Yeah. It's not just going to go away. It doesn't just disappear because you've changed your mind. It actually takes time, and it takes what we have to do is look at that unity that is your body and look at how that unity functions. Now, we talked in the last on the last web podcast about how your brain is the CEO and your spinal column is the VP of operations. And then you have your tendon organs, which are like little department managers, which are putting muscles to work or taking them out of work. And in this whole system where there is the Golgi tendon organs are managing basically which muscles are going to work and which ones are not going to work. So they're basically managing the local business of movement, but also they're also playing a role along with some other organs in protecting. So they'll add protective tone where they believe it's needed. So your nervous system might send a message to say there's danger in that area, and there will be protective tone to protect that danger. And that protective tone is going to be tightness. And that tightness and that tension is going to probably be accompanied by pain.
Yeah, and I want to reinforce that, because folks who do have pain, it's so important to know that your body's just doing the best it can to protect you. It thinks that there's danger. And so it gives you that red light reflex, which I've talked about a little bit in the past, where, it's like, stop. And so oftentimes you'll feel kind of a sense of a lifting of your pelvic floor, a pulling in of your anus, a pulling in of your abdominals. It's like a pulling inward. Your head can go forward. Everything goes forward. And that is those Golgi tendon organs and that CEO, the whole nervous system response that you're talking about. It's just our body trying to help. And so I just wanted to reinforce that again, just to know that our bodies are doing the best we can, but sometimes they do a little bit too much. They go a little too far, don't they?
Yeah, but the thing is, imagine it's a business. So in the business of your body's movement, your muscles are your employees. And these little department managers are saying, okay, that employee's out sick, or there's a little bit of danger over there. We're going to make these other employees work a little harder. But the thing is, nobody tells them then that it's that employee's okay, they can come back to work now. So unless you actually do something to show your nervous system that there is safety there, it's not going to know that there's safety there. So this is what we talked a little about patterns in the last episode. Let's say that you sprain your ankle. So you sprain your ankle, some of the muscles are going to be out of work, there's going to be a bit of swelling. When the tissues have all healed, you might still have a limp. Unless you show your nervous system that it's okay to walk again, that it's okay to put all these muscles back to work, your nervous system isn't going to know it's okay to take that movement. Or if you hurt your shoulder and you're unable to reach your arm up over your head, when the shoulder heals, if you don't show your nervous system that you can make that movement again, and if you don't tell the nervous system that it's safe, it's not going to know that it can go there.
Mm-hmm, mm-hmm. So how do you recommend? Is this a pattern of how do you recommend relearning?
So one of I always start with relaxation.
Mm-hmm.
So
yeah.
It is an issue with tension. So very often where you have chronic pain, you have chronic tension. So you have muscles that have they're being put under immense load. And when it's in the pelvic floor, it's particularly difficult. So if you think about when you're walking, every time you put your foot down, there's a ground reaction force that comes up through your leg. Now, the muscles in your leg need to balance the load of that tension as it moves through your leg and up towards your pelvic floor. And then there's also kind of the tension that's kind of coming down a little. So the pressures when you're in your intra-abdominal cavity when you're moving. If there's tightness, then that can have a greater impact. And what we need to do is get everything to relax. So I always start with the yoga nidra, with the body scanning meditation. So lying out flat, relaxing, and feeling around the body to try and find where there's tension. Breathing in such a way that you can tap into your parasympathetic nervous system is the next thing that I would do. So when you breathe, and it's a very simple exercise, but it's very, very useful. When you inhale for the count of 4 and exhale for the count of 8, you extend the out breath. You are basically telling your nervous system that things are okay. You're tricking the body into moving more into the rest and digest. Mm-hmm. And this is helping to calm things down. So when you feel the pain, the breathing exercise of, I always do 10 calming breath cycles. So inhale for 4, exhale for 8. Inhale for 4, exhale for 8. And nice and slow. And the whole time just trying to let go, trying to relax and remembering safety. I mean, remembering that there's nothing sinister in the area. It's really important.
Yeah, and it's true, because we do need to harness that calming as much as possible, because we are thinking about this area of our body, the pelvic area, which does, I mean, the survival of the species depends on reproduction and all of these things that are housed in this area. And so even if it's not something top of our mind, even if we're not even sexually active, it's still just human nature to be very protective of this area. We are very aware of this area because it is our way to reproduce. It's our way to, again, like you said earlier, defecate, urinate. I mean, there's so much important stuff that happens in this area. So of course there's going to be that fear. So calming as much as we can is a great first step. And I have to ask you, for your 4 counts in and 8 counts out, do you recommend people do this through their nose, or do you recommend,
The nose is for breathing.
Yeah, the nose is for breathing, exactly. Now, I will say I completely agree, and I teach that as well. But I have done an exhalation that's longer through kind of pursed, not really strongly pursed lips, but almost like you're blowing through a straw. And I found that to be calming as well. But I was curious. I know that there is research that shows that it's most calming to go in and out through your nose, though. Is that correct?
Yeah, but the thing is, there's actually lots of different breathing exercises. And in the book, I cover multiple exercises because there's also different reasons why you want to do the breathing exercises. We did talk in the last video about the relationship between the diaphragm and the pelvic floor, and how you want the diaphragm and the pelvic floor to move together. Well, there are different, so there's a couple of different ways that you breathe. So there's the natural breath, which is where you inhale and your body basically exhales automatically. And that happens naturally without you putting any effort. But on the inhalation, there are certain muscles that work. And on the exhalation, there's no muscles. It's just everything is just relaxing. And then there's the forced breath, where you actually, when you're doing anything a little bit strenuous, you're going to you're going to take as much air in as you need, and then you're using muscles for that. And also when you're exhaling there, you can use your muscles. But depending on the pattern of your breathing, if let's say that you're breathing at the top, you're just using the muscles at the top of your chest, or some people even I've seen use their shoulders to breathe. They're using the scalenes, and they're just lifting the top of the chest, so the diaphragm isn't moving. And if the diaphragm isn't moving, the pelvic floor isn't moving, and the tension won't move if there's no movement in there. So there are breathing exercises you can do to train the diaphragm to move more. And you mentioned there a straw. The reason the straw is effective is because it basically increases the amount of pressure that you need to produce to get the air out.
Yeah.
Now,
so in a way, that would be almost a way of almost exercising your diaphragm, providing a little bit of resistance training, like weight training for your diaphragm, just providing a little resistance to blow through to get that movement trained in. Is that what I'm hearing?
Yeah, exactly. Okay. And you can use a balloon for the same reason.
Yeah.
And also when, you can also do it where you actually collapse the chest. So where you slouch forward, and you're taking then the shoulder and all of these upper chest muscles out of the equation when you do that. And your diaphragm has to work harder in that position.
Oh, I've never tried that one. I've tried a lot of breath techniques, but I've never tried that one. I'm going to do it now while you're talking.
Yeah, the thing is, if your diaphragm works when you slouch down like this, you're not going to feel like, oh my God, I can't breathe. But if you're usually using these muscles, like if you usually like breathing just in the top part of your lungs, and when you do this, it's much harder because the diaphragm isn't, it's not used to moving enough. So that can be
that's an excellent technique. I've never done that before, and I'm proud to say my diaphragm does work well. So I was able to breathe well when I was in that hunched forward position. But I can imagine that would feel, if you're used to breathing with your upper chest and your neck and shoulder muscles, that would be almost scary to be in that position. You think, oh my gosh, I can't breathe. So I recommend everyone try that to get just a sense of how well their diaphragm is contributing to their breathing. Yeah, just a hunch forward and a rounding as you breathe. Fascinating. Thank you. Yeah.
The other thing that I think is really important to say now when we're talking about pain and about pelvic pain is that your nervous system and your brain learns pain, and learns that the pain can be there, and learns that how it feels. And if you don't remember, because the thing is that when you learn something, your neuroplasticity, your brain creates a pathway for pretty much everything that you learn. And it can learn pain. And it can just default to pain all the time unless you remind it of the sensation and the feeling of not pain. So one of the things that I do with all pain patients that I work with is get them to remember how it was to not have any pain, and not just to remember it in the mind, but this is where the mind to muscle connection comes in, to try to feel in the body that sensation of there's no longer pain there. And the biggest barrier always when you try to do this is that pain is very real and it's very sore, and it can be hard to think that I am going to be able to do this with my mind and to kind of move the pain out of the way. But you can do it. I've done it. It is possible to do.
So can you walk us through this a little bit more? I want to dive deeper into this. It reminds me a little bit of almost visualization, almost like mindset work, or even like manifestation work for those who are into that world, which I love. And visualization, what comes to my mind is the classic example of the basketball players who would visualize making the baskets, even though they weren't actually doing the workouts. They were visualizing making the baskets, and then studies showed that they came back and they were able to do really well with their free throws because they'd visualized it over and over, and even if they hadn't been able to practice. So is it kind of the same idea where you're feeling the feeling of no pain, you're visualizing how it was, you're taking yourself back? Can you?
The thing is, your brain doesn't know the difference between what you're thinking and what's real. It doesn't know that a thought is just an idea you have in your head and not something that's physically manifesting. It's the brain can't tell the difference between you having a bad thought and something bad happening at the minute. It can't tell, and it does have. You have all these memories. You have to take advantage of them. I did this with incontinent. So I was very incontinent. It was awful when they took the mesh away. I couldn't hold my bladder at all. I would just, all the urine just fell out every time I moved. It was a really horrendous thing. And I realized along the way that I needed to remember continence because my body wasn't giving me the opportunity to feel it or to sense it or to see it. It just wasn't a reality for me. But it had been in the past. And I thought, well, I have to try and harness the fact that I know continence. I've been there before. I've had this before. So I have to take that. And it was the same with pain. It doesn't just, this doesn't just work for pelvic pain. You can also use it for pain in other parts of your body. But when you have pain, one of the things that you can do is, again, you have to find a very calm place. You can do the 10 calming breaths, relax your whole body, close your eyes, and where you feel the pain, try to, in your mind, find the memory of how it was to be there without the pain.
So you'd almost take yourself back to a time. Okay. Yeah. Mm-hmm.
And take the sensation, because you can remember the sensation of there not being pain there. And you have to try to almost swap the sensation. So the sensation of feeling pain in that area with this. Now, it is harder to do. Let's say if the pain is in the center of your pelvis and you're trying to replace the pain in the center of your pelvis with the memory of there's no pain in the center of my pelvis. But if you have the pain on the left side, for example, then what you can do is focus on the right side where there's no pain and bring that sensation to the opposite side. So it is easier to do when you have pain on one side than when you have it right down the middle, shall we say. Mm-hmm. But it is so that, that's a practice that can help, and the remembrance that things are safe. So that's there's no danger there. If you keep telling yourself that there is no danger in the area, that all you're trying to do is find a way to communicate to your nervous system, to get through to the nervous system and let the nervous system see that the danger has gone.
Yeah. Turn off that red light reflex. I love that. So to recap so far, we've discussed the deep breathing, the 10 deep breaths with the longer exhales versus the inhales. So the exhalations are longer. Talked about the yoga nidra with the body scan where you're feeling into those areas of tension and doing that deep breathing. We've talked about this remembrance of the times when or the sensation, I should say, of there being no pain. What else am I missing? I think those are the main things we've talked about so far. Yeah.
covered. And another thing that you can do, so a lot of the work, a lot goes into kind of looking at what traumas have been there. Now, very often, if you've suffered abuse or severe injury or some sort of a trauma in an area, then that, in yoga we say that you have issues in your tissues. So if you've been through a trauma, the trauma remains in the tissues, and there is a little bit of work involved in letting it go. And a lot of yoga actually is in trying to relax and let go of tension that you've carried around in a specific area for a long time. So it can be good to work through those issues with a therapist if there is something around that area. The other thing that you can do is actually write out your pain. So describe your pain, write it all out, and then look at the words that you've used and change the wording. So you can change the word pain to discomfort. You can change like searing to something else, like tingling. You know, you can just take different words and use different words to describe your pain, because that also is another way of communicating to your brain that it's not it's not danger, that there is safety there. And the difference that it makes first and foremost, you should always get checked if you have pain. But once you've been to all the specialists and they're all telling you there's nothing there, there's nothing wrong, then you know that there's no pathology. You know that the tissues are okay, the tissues are intact, everything, let's say physiologically, is okay. But the nervous system doesn't know that yet. So all we're trying to do is to find a way to show the nervous system that actually everything's okay here.
And I like what you just said about the wording. What came to my mind was this almost stepwise process where if we try to go from these big pain words and these big pain feelings to, oh, there's no pain, that might be a big leap. But if you almost take a stepwise approach to stepping it down a notch versus kind of like with affirmations. So let's just take this to the mindset world. Say, I want to be a quadzillionaire, or I want to be a whatever, like some huge number. I am a billionaire. That's a pretty big leap. But if you're trying to just take it a step up, if you're wanting to manifest wealth, maybe you say, well, you know what, I made $10,000 this year, or whatever. We take a very stepwise approach toward that bigger goal so that it's still a stretch, perhaps, but we can believe it. And so that's kind of what I'm hearing from you with your pain words. Rather than going from big pain words to zero pain, we're taking it just down a little notch. To maybe instead of searing, it's tingling. And then maybe soon, once you are feeling that in your body and believing that word more, you can take it to just maybe warmth, or maybe, just some words that are a little gentler. So gentler and gentler and gentler, rather than going from the pain you're in to no pain.
Yeah. And another very important way to communicate with the nervous system is through movement. So yes. When we have pain, we don't want to move. But actually, if you don't move into the pain a little, then you don't show the nervous system that it's okay to move into the pain a little.
Yeah. Again, that stepwise approach. Yeah. Yeah. And I will say one more thing about that is that you talked about how it's a very emotional area, the pelvis in particular, the shoulder girdle and the pelvic girdle. It's where we store all of our tension. You'd spoken about yoga and how or I guess maybe it was my brain that just went here, but how sometimes people in our yoga classes may experience a release of emotion in the yoga class from doing certain stretches and movements. And I actually had never experienced that in yoga, but I did experience it in a very slow, sensual movement class that I took within the last couple of months. I absolutely broke down, and I've never experienced anything so profound. So it was the concept of this very slow, very small, tiny movements, but something about that just went straight to my emotional center right there. And I think that's kind of what you're speaking to a little bit as well. This sort of, it doesn't have to be a big movement or a big stretch. It can be very small, and it can wake things up and speak to you in a different way. Yeah.
I'm a yoga teacher. Yeah. In my yoga classes, there's always at least one person that has an emotional release in the class. And I personally have had multiple different classes. I've had emotional releases, and it always takes me by surprise, because very often you're not thinking about anything, but it's just because you're allowing your body to kind of relax into, and maybe some little employees that hadn't been at work are put back to work, or they're getting a little stretch, and all of a sudden your nervous system is like, oh, we can let go of this now, and out come the tears, and even the body sometimes shakes. Like it's quite interesting. We don't know. There's just so much we don't know about the body yet, and when you're talking to all these different specialists, you have to remember that there's so much still to find out about how everything interacts and how everything works. And when you're taking the investigation into your own body and working on your own journey of empowerment, you should do that with curiosity. Yeah. And you should do that just trying to see and feel, well, how can I get maybe a little bit more control over things, while at the same time completely letting go? Because, we really don't have any control at the end of the day. That's kind of what it boils down to. There is no control, so you have to let go. But you can change, but the way that you think about your pain can dramatically change the way that the pain manifests in your body, because your thoughts are directly communicating with your nervous system all the time.
Absolutely. And so I love, just to kind of go back to the beginning, the way to strip this all back to the basics is to go back to the breath.
Yes.
And just calm it all down, because that's the only way we can really tune in, is when we're in a calm state, when we're in that blank slate where we don't have the sympathetic, that kind of clouding our judgment. The calm state is important so that we can do this investigative work. Yeah. So yeah. Amazing. Denise, thank you so much. I'm going to be sure to put links to your website, The Flower Empowered. It's theflowerempowered.com, correct?
Yes.
Okay.
Correct.
And then tell us a little bit more. Links will be to everything in the notes below the podcast and or YouTube video, however you're viewing this. But can you tell us briefly a little more about your book?
Yeah, so the book, I decided to write the book following my own journey, because when I came back to Sweden after having the mesh removed from my body, and I was completely incontinent, I had no support and I had nobody to talk to. And I had overactive bladder, I had pain, I had just this constant leaking, I was getting tighter and more tense. And I was it was a really bad place to be. And I had to empower myself. I realized that either my life was ending and, things were going to just go downhill and I was going to deteriorate, or I was going to somehow manage to take control of this and move away from that. And I learned so much in my own journey of empowerment, my own investigation into my body. And I realized that I'm not alone. I felt very, very alone, but I'm not. There are 1 in every 3 women will have problems with their pelvic floor, 1 in every 10 men. I get almost as many inquiries from men as I do from women. We need to break the taboo surrounding pelvic floor dysfunction. I was alone because nobody talked about these things, and I wasn't able to talk about them initially. And then I realized, if I can't talk about them, then that means that nobody else can talk about them. So even though it was embarrassing, I said, I'm going to stand up and I'm going to talk about everything that I have been through, and together we can and will make a difference. I say this at the end of all my YouTube videos. I think that when we come together, things will change. And if everybody changes their mind about how they view incontinence, pelvic organ prolapse, sexual dysfunction, any of these issues, then we can collectively, globally change the way we approach these things and help people so that they don't have to suffer in silence.
Mm-hmm. Oh, I love it. Oh my gosh. So inspiring. I just want everyone to please, look at the links, check out Denise's information and site and book and all of the things. And I want to give you a big thanks from the bottom of my heart for being here and for doing this great work in the world. You and I are both on a mission to make change happen. And this is really important stuff. I think some people may not realize that. Why are these people all talking about pelvic health? But it's so important. Our bodies, our physical us, we are so important. You know, we are all what make up the world. And this part of our body is so huge. It's so huge emotionally, physically, on every level. So really, this actually is where it's all at, right here. I am firmly convinced. And
your quality of life is very, very much connected to that part of your body.
yes.
And, you know, it can stop you from moving, socializing, doing things. We need to get people moving if they've stopped.
Yeah,
you know, we need
exactly.
we all have to come together. And you, Dr. Bree, actually played an important role in my journey as well, because I actually was watching your YouTube channel when I was sitting at home crying in a puddle, basically. So you played a very important role in my journey too. So what you do is amazing, and keep doing it. I think we need a million more people doing this in order to get to all the ears that need to hear it, the eyes that need to see it.
I agree. And I have no qualms in supporting any woman or man who's on a mission to raise awareness and to do their great work about pelvic health, because there's certainly no shortage of clients for everybody to have and to work with me and you and all the other wonderful people who are doing this great work. Because like you said, 1 in 3 women, you know, will experience the bladder leakage. And there's so many statistics like that, prolapse, the pelvic pain, all of these things. This is a huge thing. We're talking billions and billions of people. Well, thank you again, Denise. And thanks everyone who's been tuning in. And definitely remember, as always, my friends, eat clean, move every day, and you will shine brighter. And don't forget to check those show notes. All right. Thanks, Denise. Bye.
Thank you. Bye.